Well, it was more than 2 years ago. I not only got my first mammogram, I let the cameras follow me. I had put it off for about 5 years, and in the end, I discovered it was nothing to be nervous about. I wanted to bring awareness to how important and how easy a mammogram is, and it really was easy. I was surprised. Unfortunately, many women do let their nerves get the best of them and even skip their annual mammogram.
So you may be asking, how many? Well, according to the most recent information from the Centers for Disease Control and Prevention, just over 67% of women ages 40 and over had a mammogram within the previous 2 years of 2010. Wouldn't it be great to get that number to 100%?
It's important to get past that fear. It may just save your life. And joining us today to tell us more is radiologist Dr. Simmi Chawla with Peninsula Imaging in Salisbury. Thanks for joining us this afternoon.
Well, thanks for having me.
So first, right off the bat, Dr. Chawla, how important is a mammogram?
Mammogram is very important. There are certain cancers that are not going to be picked up on physical exam or by the patient, and the mammogram can pick up these occult cancers. So very important to have a mammogram every year.
So a big point of discussion, it seems like for quite some time now, is when should you get your first mammogram?
So the American Cancer Society recommends that all healthy women have annual mammograms after the age of 40.
Okay.
Now, what if we have a history of breast cancer? Say my mother or my grandmother has had it. Do the recommendations change?
There are recommendations for risk stratification, and once there's different models, once they stratify you as a high risk, then they do recommend mammograms earlier, even MRIs. And the good news is that there are plenty of facilities, including our facility at Peninsula Imaging, that perform both studies, and we have a few patients that do need earlier imaging and they need MRIs for screening.
Okay.
Now, one thing I didn't know is that mammograms can both screen and diagnose. There's two different mammograms. What's the difference?
So the screening mammograms are what we need, just like it's a kind of a surveillance type of thing, just like you get your blood pressure checked or you get your weight checked when you go for a routine checkup. The screening mammogram is offered to all women with or without a history, just every woman over the age of 40. The diagnostic mammograms are different type of mammogram. It's the same picture of your breast, so to speak, but it is geared more towards an actual problem that the woman is having. Either they're having nipple discharge or they have a lump that they felt in the shower, very common. And they could be 20 years old, they could be children, they could be 39 years old, where they wouldn't have actually met the criteria for a screening mammogram or the guideline criteria for a screening mammogram, but they actually have an abnormality that needs to be worked up. Those are diagnostic mammograms, so that's the difference.
So is there an MRI option in here somewhere?
MRI is a tool, just like mammography is. It's considered not a screening tool unless you're in a high-risk stratification, which falls in less than 2% of the population. But we do use MRI in the diagnostic sector for women who have lumps that we can't see on the mammogram or we can't see on an ultrasound. So if we get frustrated or if it's just too complex, then we would sometimes recommend an MRI to further evaluate that. And it is good. It's a good tool. It's excellent. And the three together, it's approaching close to 98% in picking them up, because ultrasounds and mammograms don't pick up all the cancers.
Right. And you know, there's that time between the time you get the mammogram and the time you get the letter saying, you know, it's all clear or whatever. And that's kind of a fearful time. How do you get women to get over that fear?
To get over that fear, yeah. Yeah, once you turn 40, there's a lot of different things that have to occur. I guess the main thing to understand is the first screening mammogram that you'll get, it's just a 20-minute exam. It is a picture. It's just it's not like some dentist drilling your teeth. It's just a picture of your breast. So when you come in to the office, you'll meet a technologist who will use compression. The compression is not for 20, it's just a few seconds. We take 4 pictures, minimum 4. Sometimes we'll have to repeat a view, and then you can put your clothes on, go home.
It really doesn't hurt.
No.
That was the thing that surprised me.
No, it doesn't. There's a little bit of compression, and it's nice to time the mammogram when you're off cycle, when your breasts are not so sensitive. But the anxiety comes then waiting for the results. At our office, we performed, in 2013, we performed 10,400 screening mammograms. And 12% of patients were called back. And it's important to know that the anxiety comes then, is waiting for whether you're going to be one of those 12% that are going to be called back. And if you are, it's important to realize that not everybody who comes back has a cancer.
Right.
Really, what the radiologists do when they read the mammogram is to try to see if there could be something there. And sometimes it could be as simple as an area of your breast that didn't properly get compressed. It's just normal breast tissue, but it didn't properly compress out, and it casts a shadow. Or it could be that maybe you were wearing deodorant the day you came in, and we need a better picture because we can't, because the deodorant has these little particles that can look like calcifications. So when we call you back, we'll have a repeat, but it's not necessarily that you have cancer. In fact, we did something like 4,200 diagnostics last year, and we recommended 14% to have biopsies.
Okay.
Those were suspicious findings that were not, like I told you, just compressed breast tissue. Those were ones that we were concerned. And among those, we picked up 79 cancers.
Wow.
How about that? So bottom line is...
Get your mammogram.
Get your mammogram.
Thank you so much.
Thank you, Dr. Chawla. It's wonderful having you in today.
And to read more from Peninsula Imaging about mammography, go to WBOC.com and click on our picture at the top of the page.
Now, the hardest part of some breast cancer battles is saying goodbye to those who lost their fight. It's something Kate Edwards knows all too well. In 2010, she lost her mom, Elizabeth, to metastatic breast cancer. Kate joins us next to reflect on her mother's legacy and to tell us how she is now raising awareness of the disease.
And we're raising awareness of a couple of new studies that show the relationship between your health and tumor aggression and development. Find out how obesity, even your skirt size, may play a role.
And a little later on, how one breast cancer survivor uses her experience to help others live life to their fullest. It's an inspirational story you don't want to miss. Delmarva Life will be back in just a moment.